Hi everyone, this is Shalli Kumar again from OSCE Nurse Training Cambridge. I'm an experienced OSCE Nurse trainer for the NMC OSCE exam in UK and also the lead trainer for OSCE Nurse Training Cambridge. Welcome back to my YouTube channel again. I am back with another NMC OSCE video for all the nurse colleagues who are out there preparing for the NMC OSCE exam. Okay, so if you do like my channel, please like and subscribe and share with other nurses. So today's video is all about writing care plans. As nurses, we know that we need to plan care for the patient and needs to be documented. So we need to have a documented plan of care for patient nursing needs. So that's what we're going to look at today, how we can actually write in a very simple and clear way our care planning for NMC OSCE exam. So there is a set template in NMC OSCE exam for you to write care plan. So my job today is to make you understand in a very simple way what does those headings means and what are you supposed to write, how much are you supposed to write, and how you supposed to write. Okay, so in the simplest way possible. Okay, I have already done lots of care plans and there are example care plans on the YouTube channel already, so you can go ahead and watch those care plans anyway. But today we're going to learn the principles of it and then you can then apply it to different planning needs for your patient. Okay, so that's what we're going to do today. So let's get started. As you can see, planning is 14-minute written station in your exam, and you have a front sheet of the template where your scenario is introduced to you again, but it's the same patient you have already met in assessment station. So planning is the P part of the A pie. So you already done the assessment on this patient. Now you're going to write 2 care plans based on the assessment. So the front sheet tells you that it's still the same patient. You need to write in black pen. You need to write 2 relevant nursing needs. Your handwriting has to be clear and legible. That goes without saying. And date and time. And so that's what is on the front page, and it does tell you what today and what time you're writing these care plans at. So that's the details given to you. So if we just quickly go through the template, on the inside page you have 3 pages. Page 1 for first care plan, page 2 for second care plan, page 3 is just in case if you end up writing a wrong care plan. So say your second care plan was wrong, so you cross that out and then you write your new care plan at the back page. Okay, otherwise you do not need to use that page, as I have highlighted on the screen, so you don't need to use it otherwise. So that's just a quick revision of what planning is and what does template look like. So we're going to now look inside the template, because all the pages are the same. So the template for every care plan is the same. So let's have a look at the headings. Let's understand what we need to do with it. Okay, so let's have a look at the first one on slide on your page on your screen now. Nursing needs. So that's the first thing. So the top section is about patient details. That's already completed. You don't need to worry about it. You need to start from the nursing needs section. So what do we read in this part of the care plan? Well, it's quite obvious that you need to write clearly a nursing need or a nursing problem of your patient. Okay, so 2 care plans, you need to choose 2 nursing needs for the first care plan and then second one for the second care plan. So how do we make sure that our nursing need that we pass in this section of the care planning? Because most of the nurses who fail this station fail on not choosing the relevant nursing need for your patient. So how do we make sure that we are correct in this section? First thing is, I already told you, the nursing need has to be the relevant to your given scenario, to the patient you have met in assessment. Second thing is, always choose, you can choose, the best thing is to choose 2 nursing problems from the presenting complaint section of your patient history form, because your patient history form from assessment station is given back to you in this station. So you will go to that page of presenting complaints and you will choose 2 relevant complaints or problems for your patient. Another very, very, very good tip I can give you: always think about presenting symptoms. So if your patient is coming with pain due to hip fracture, then pain is your presenting symptom. If your patient is displaying a headache and nausea due to subdural hematoma, then headache and nausea are your presenting symptom. If somebody has got shortness of breath due to chronic heart failure, pneumonia, asthma, then shortness of breath is your presenting symptom. So your presenting symptom should always be your first nursing need. So that is a very good tip for you. Already one need is chosen for you. So your first nursing need can always be your presenting symptom. And if the presenting symptoms are more than one, then of course you got two nursing needs there. So always choose your presenting symptom as one of the nursing need, and then see how that diagnosis is affecting any other activity of daily living for your patient, and then you can choose that as your second nursing need. So I have already done lots of care plans for you, showing you different nursing needs, and I've also done a lot of different scenarios for assessment station which talk about the nursing needs. Okay, so go ahead and watch those videos. I will highly recommend that you go to the API playlist in my YouTube channel, and go and watch those. Okay, so that will give you very clear indication what scenarios, what kind of nursing needs you can choose. But always go for a presenting symptom, and then look for another complaint in presenting complaint section of your patient history form. So that's the nursing need. Going on to the next screen now, aim of care. So what is aim of care? What you're supposed to write here? Aim of care is simple word, is the goal. It's the goal you want to achieve for that particular nursing need. So how do you want that nursing need to be sorted out? So what is your goal? So if somebody is experiencing shortness of breath, our goal should be to reduce shortness of breath and achieve normal respiratory rate. If somebody is in lot of pain, say their pain score is 6 out of 10, our aim could be to reduce the pain and achieve pain score of below 3, which is mild pain. So we could aim for below 3 out of 10 pain score. So if somebody is at risk of developing malnutrition, our aim should be to prevent malnutrition by increasing oral intake. So as you can see, your aim has to be specific to your nursing need. That goes without saying. So if your nursing need is about reduced mobility, your aim is about mobility as well. If your nursing need is about pain, then aim of care has to be about reducing pain as well. So it has to be specific to your nursing need. Second thing is, clarity is important in aim of care. So don't make a full paragraph out of it. Just one or two sentences, but very clear what you're aiming for. So if somebody is at risk of developing wound infection, say post-op, our aim should be to prevention of wound infection. So if your nursing need says risk of something, then you can always add prevention to prevent that risk in your nursing need. So it has to be relevant. It has to be very clear. So aim of care is what's the goal. It's not about how you achieve the goal. How you achieve the goal is your interventions, and you will write those in the intervention section of your care plan. So lots of people, sometimes I see nurses writing lots of interventions in this section. No, what they're going to do, no, that is intervention. What you're trying to achieve. Okay, so keep it simple, keep it clear. We are not looking for a paragraph here. We are looking for 1 to 2 sentences, very clear, saying if it's shortness of breath, my aim is to reduce the shortness of breath and achieve normal respiratory rate. If it's pain, then it's to reduce the pain below 3 out of 10. If it is I don't know, malnutrition is to prevent malnutrition. If it's wound infection risk, then is to prevent wound infection. If patient got nausea, then our aim is to reduce the nausea and prevent dehydration. So it has to be very simple and clear. Next is our coming to the re-evaluation time frame. So there is a lot of confusion about this section of the care plan. Lots of nurses ask me, what should I be writing in that? Okay, so the marking criteria is very clear about this particular part. It says about re-evaluation of the nursing problem. So when you look at those words, re-evaluation of the nursing problem as in the marking criteria, then it's very clear it is about re-evaluation of the nursing need, the nursing problem, not the re-evaluation of the care plan. Okay, so lots of people think it would be after next 24 hours, because that would be when we re-evaluate the care plan. No, it's not about that. It is about how often Just simply time frame. Time frame means frequency. How frequently or how often you will go and check on that nursing need, for how often you will reevaluate that particular nursing need. So it's pain. So you will write first the today date and time from the front of the template, because this is the first time you're evaluating that nursing need. So you will say today date and time from the front. Then you will say reevaluation. How often should I reevaluate this? So it will be, if it's pain less, for example, how often would I go and check on my patient regarding pain? 30 minutes after giving pain relief. If I given pain relief, I will check on 30 minutes after giving pain relief. I could also check the pain at 2-hourly nurse rounds, because we should be all doing, that's the recommendation from the health board, that we should be doing 2-hourly nurse rounds in our wards to check on our patients. So we could say 30 minutes after giving analgesia, 2-hourly as per nurse round, or sooner if patient clinical condition changes. So you can put that. So if he's a community patient, of course, there is no nurse round, so you could talk about that patient will be reevaluated at next nurse visit. Or if he's a post-op patient, of course, it has to be more frequently, because your post-op patient is at high risk of developing problems post-operatively. So it's a different for kind of, you have to adapt it to your scenario. Again, I've done lots of different care plans for you, so go and watch those care plans and you will have then better understanding of this section. Okay, but this section is about how often you will go and reevaluate the nursing need. Most of the nurses ask me, is it about whenever we do patient vitals? No, because your patient score, if your patient score is 0, say, you're not going to do their vitals for 12 hours as per news policy. Are you not going to go and check on your patient nursing need for 12 hours? You will, because that's not a safe practice, that I don't go and check on somebody's pain for 12 hours or their shortness of breath for 12 hours or something else. Of course, that would be too long a period. That's not safe practice. So it's not actually the monitoring frequency of your vitals. It's not related to that. It's basically how often you will go and check on your patient regarding the particular nursing need. So I hope that's clearer to you now. Next is slide is about the interventions. So what is it all about? Intervention is just your nursing interventions. So some interventions are quite general for all patients, like taking consent, monitoring of vitals, documenting all care, administration of medication as prescribed. So those are your general things you will write in every care plan. But then there are some particular things you should write particular to their nursing problem. Say if it's pain, so I will write, I will assess my patient pain using pain tool 0 to 10. I will give appropriate analgesia depending on the pain score. I will check my patient effectiveness of the analgesia given. I might teach my patient some deep breathing exercises or diversional therapies to relieve pain. So those are your particular interventions then for just for that particular nursing need. So you might refer your patient, if his pain is chronic, to the pain team. If it's just acute pain, maybe to the medical team on the ward. So it really depends on your scenario, but your particular special interventions will be related to that nursing need. Others will be general interventions, like I told you about the consent and monitoring vitals as per news or GCS policy, and then your documentation of the care and administration of all medication as prescribed in your drug chart. So there are some then you will write some general ones and some special ones for that nursing need. So lots of people ask me how many to write. It's not about how many, it's what's important for that particular nursing need. Another thing is nursing interventions is about the quality, not quantity. Don't keep repeating yourself about the same point by changing the language a little bit. That will not get you anywhere. So it is about the quality of your writing rather than how many have you written. There is no fixed number. It's all the important interventions for the particular nursing problem. Say you're talking about prevention of malnutrition as your aim, but you haven't written about recording patient oral intake, monitoring and recording oral intake in a chart. Now that is a very important intervention for preventing malnutrition, and if it's not there, of course it will be critical fail. So it's not about how many, it's about what is important. Okay, They have to be relevant to your nursing need. They have to be evidence-based practice. Do not make homemade remedies. You should not go into your nursing interventions. Whatever you write has to be backed by the science, has to be a best evidence-based practice point. Okay. And the last thing now we're coming to, so that's about interventions. So lastly, we're coming to your, make sure you don't make this mistake, because lots of nurses, it's very common to fail on this very simple thing, to just remind you that name, time and date has to be on every care plan. Make sure you add that, because if you don't, you will really struggle. Okay. Of course it would be a critical fail, not struggle, it would definitely be a fail. So I would say make sure you do that name, date and sign as soon as your timer starts. Do that and then start writing. Okay, so that's a good tip to not make that mistake. So hopefully this all helps you. But like I said, and just going back to the next screen now, where can you get more support? I have done lots of care plans for you, example care plans for community scenario, for Alzheimer's scenario, for shortness of breath scenario, for malnutrition, loss of risk of fall, for the subdural hematoma scenario. So there's loads of care plans already done. So go ahead and revise those care plans. And then after learning the principles today and after revising those care plans on my channel, I'm sure you will have really good understanding how to tackle this station in your exam and hopefully pass it first time. Okay, so if you like my video, please press the like button now and subscribe, share it with your friends, keep sending the comments in, they do really do help. Go and check our Google reviews. We have reached 100 now, over 100 now, 5-star reviews, so we're really proud. So go ahead and check that and visit us on OSCEnursetraining.com, email us on OSCEnursetraining@outlook.com. I will soon be back with another video for you, so bye for now.